Hello, welcome all of you to our online tutorials once again. This is actually live from our Zoom discussion or our Zoom tutorials. All right, so basically this is Krok 1 2010 booklet and yeah, for medical students. So without wasting my time, let's just start right away. We have an unconscious patient who was delivered to the admission ward. So the patient's skin is cold, pupils are myotic, and he has labored Cheyne-Stokes respiration. Arterial pressure is low. The urinary bladder is full, and they are asking what substance has caused this intoxication. So we are looking for a substance what abuse. We are looking for a substance abuse. All right. So basically, what we know is that the drugs that are usually abused are what are opioids, and their overdose usually causes what physical and the mental what symptoms such as what unconsciousness, normal or increased reflexes, meiosis, bradycardia, Cheyne-Stokes breath or shallow breathing. We can also have urine retention, and sometimes we can have what spasm of the intestine and the bowel. So this phenomenon or this sort of opioid intoxication is also known as narcotic analgesic intoxication. Narcotic analgesic intoxication. So how do you treat this kind of person? You normally we give the person what? IV naloxone. IV naloxone. This is the recommended antidote for narcotic what? Analgesic intoxication. So that is what is causing, or that is what is happening in this what patient. So here our answer should be what? Should be C. But we're not only interested in the answer, but we also want to learn something further to know what the other causes or what the other options stands for. All right. So we actually have what? Tranquilizers. What are tranquilizers? These are class of medications that can cause mild what? Sedation and or what? Anesthesia. They provide relief from anxiety, they induce sleep, and they prevent what? Seizures. They prevent seizures. So their intoxication, what will it cause? Intoxication will usually lead to what? Loss of coordination, paradoxical agitation, blurred vision, or other visual what? Impairment, slurred speech, confusion, amnesia, drowsiness, and then what? Unresponsiveness. All right. So which one of them normally causes intoxication? These are what? Barbiturate. And you can treat it with activated charcoal. Activated charcoal. Activated charcoal. So again, let's talk about the muscarinic what? Receptors, antagonists. So these are what? Anticholinergic what? Agent that blocks the activity of muscarinic acetylcholine receptors. So they block these receptors. And what are acetylcholines? Acetylcholine is simply a neurotransmitter that is found in the brain, the neuromuscular junction, and the autonomic what? Ganglia. Autonomic ganglia. And they are actually of two types. We have the muscarinic and then we have nicotinic. So in the area in which the neurotransmission is taking place, some are very, very receptive to muscarinic, and others are very, very receptive to what? Nicotinic. But over here, we're referring to what? The muscarinic what? Part. Muscarinic part. And the overdose usually leads to what? Arrhythmia, dizziness, glaucoma, confusion, hallucinations. Can we have what? Dryness of mouth. Dryness of mouth. And how do you treat this? You know, usually the one that is usually abused is what? Atropine. Atropine. So atropine is actually what? A muscarinic what? Receptor blocker. So you treat it with what? Physostigmide or physostigmide. So that's what we use in the treatment, or we use as an antidote for atropine overdose or for muscarinic what? Receptor blocker. I know all those things are not important right now, but for the sake of learning and for the sake of twist of Krok questions, because now they are twisting the questions here and there. So we want to give you an overview of at least everything. These are everything that you need to know about the intoxication or about the options that have been presented to us. But for this particular question, your answer should be what? C. So we have a characteristic sign of glycogenosis. Glycogenosis is what? Muscle pain during physical work. They are saying examination revealed hypoglycemia. So this pathology is caused by the congenital deficiency of which enzyme? Which enzyme? So to answer this question, you need to know what glycogenosis stands for. So what is glycogenosis? Quickly. So this is, we normally call them glycogen storage diseases. Glycogen storage diseases. And this is a metabolic disorder that is caused by enzymes affecting either the glycogen synthesis. Don't forget, a glycogen is a stored glucose. Stored glucose. So either there's a problem affecting its synthesis, or there's a problem affecting its breakdown. Its breakdown, all right? Or even glycolysis, that is glucose breakdown. And typically you can find them in muscles and even in liver cells, and even in liver cells. So we have a lot of types. We have about 5 types. I mean, there are more than 5, but the ones of importance at our level are these 5. So it's very necessary you know these types of glycogen storage diseases. Glycogen storage disease. So we move to the first one, which is type 1. So what is type 1? So type 1 is the most common form of glycogen storage diseases. Another name for the type 1 is the von Koech disease. The von Koech disease. So people with this type don't have the enzyme glucose 6 phosphatase. Glucose 6 phosphatase. So if somebody is deficient of glucose 6 phosphatase, the person develop von Koech disease or type 1 disease. And what does the glucose 6 phosphatase do? They are needed to turn glycogen into glucose in the liver. You know, glucose is the form that is actually needed to produce the energy for the cells to carry on its activity. So when the glycogen is stored, or when the glucose is stored, it needs to be broken down to glucose to be used by cells again. So when this enzyme is deficient, what it means is that these glycogen cannot be broken down to form the glucose that you need. All right. So what happens? So the glycogen now builds up in the liver. They build up in the liver, and they lead to some symptoms usually that appear in babies around 3 to 4 months old. And what are some of the changes that you see? We may see hypoglycemia or low blood sugar, and we can see swollen belly because of the enlarged liver. Don't forget, we are saying that glycogen will build up in the liver. So what it means is that the liver will become enlarged. It will become enlarged, and eventually it might seem that all the belly is is swollen. All the belly is swollen. All right. So that's type 1. Now let's move to type 2, which is also called bumper disease. Bumper disease. So this is actually caused by the accumulation of glycogen in lysosomes. Lysosomes. Why? Due to the deficiency of lysosomal acid alpha glucosidase enzyme. Glucosidase enzyme. So when this enzyme is deficient, you develop type 2 or bumper disease. So it affects mostly the liver, the heart, and the muscles. What are the features? So you can see severe muscle weakness, also known as myopathy. So if it is affecting the heart, you can have cardiomyopathy, right? Cardiomyopathy. So these are actually, cardiomyopathy is one of the major symptoms found in children. found in children. Then we also have what? Abnormally diminished muscle tone. So also termed as what? Hypotonia. Hypotonia develops without muscle wasting. And this usually manifests within the first few months of life. Manifest the first few months of life. All right. So don't forget again, this question, they are referring to what? Pain during what? Physical what? Work. So what can cause that? We'll get to that later, but I want us to know everything about glycogen storage diseases. This is the purpose of our learning. The purpose is not to focus on just the answer. We want to understand, just in case they change the question, what do you do? So we have type 3, and type 3 is also called what? The Corey or the Forbes disease. So it occurs due to deficiency of what? Glycogen debranching. Don't forget this word, debranching what? Enzyme. And these enzymes help to break down what? Glycogen. They help to break down what? Glycogen. So as a result, since the glycogen is not broken, now what happens? They collect in the liver and in the what? Muscles. They collect over there, they accumulate over there. So it presents in infancy or early childhood with hepatomegaly, hypoglycemia, hyperlipidemia, growth retardation, and muscle weakness. Muscle weakness. So if you see these symptoms and you see that there is a deficiency of debranching enzymes, then you are thinking of what? Type 3. Type 3. And usually too, they present in their history with what? Seizures. With what? Seizures. With seizures as well. So these ones helps you to know that you are dealing with what? Type 3. Now we have type 4, also known as Anderson disease. And these people have abnormal glycogen. Look at it. We have what? Abnormal what? Glycogen due to deficiency of glycogen branching enzyme. Don't confuse type 4 with type 3, which is what? Debranching what? Enzyme. This is branching enzyme, which is necessary for what? Normal glycogen production. So when this enzyme is deficient, you begin to produce an abnormal form of what? Glycogen. An abnormal form of glycogen. All right. So clinically, what do we see? We see hepatosplenomegaly. That means the spleen in the liver all become what? Enlarged. You can see what? Cirrhosis of the liver. And sometimes it can lead to what? Hepatic failures. Hepatic failure. It can lead to hepatic failure. And now let's move to the final type. For our discussion anyways, we have the type 5, which is also called the McArdle disease. The McArdle disease. And this is caused by an inability to break down glycogen in muscles due to deficiency of this enzyme, glycogen phosphorylase. Glycogen phosphorylase. So the glycogen is not able to be broken down in the muscles. So these people normally experience what? Fatigue, muscle pain, cramps during the first few minutes of exercise. Look at this. So this is actually what? Exercise induced what? Cramps, also known as exercise what? Intolerance. So they don't like you to do what? Exercise. And these people, when they rest a little bit, they are very fine. And and one phenomenon that happens in this case is that after they rest, they can even continue the exercise and they'll be much better. They won't feel any pain at all. And this phenomenon is called what? The second wind. The second wind. So they can usually what? Resume exercising with little or no what? Discomfort. Very interesting in McArdle what? Disease. So these things help us to know what type of glycogen storage diseases that we are what? Referring to. And from our question, we are saying that the pain developed after what? Physical what? Work. In other words, maybe after exercise, after running, after lifting a metal, after doing something like that, that is when this pain what? Developed, or that's when this muscle cramps what? Developed. So what type of glycogen storage disease are you thinking about? Yes, type 5. Type 5. And what enzyme is deficient? Glycogen what? Phosphorylase. So over here, your possible answer or the right answer should be what? Should be A. Should be A. So A should be your correct answer. All right. I hope you are making your notes and stuff like that, because we are moving and we are learning along. We are learning. Every topic, every question, I try to dive a little bit deeper to help you guys. Now, look at this. This is just a summary of everything that I've just said. So we have type 1, type 2, type 3, type 4, type 5. We have a lot of them. But this is just what? A summary of everything that we have what? Just discussed. So take your time and go through these stuff. It will help you in your exams or in your preparation towards your exams. So next question is, what a woman works as a railway train traffic controller. She suffers from seasonal vasomotor rhinitis and get treated in the outpatient setting. She was prescribed with antihistamine that has no effect upon the CNS. So this should be your guide. It has what? No effect. No effect. Now, look at the option that we have here. All of them are antihistamine drugs. Antihistamine drugs. So the question now is, which one of them do not have any effect upon the central nervous system? So first of all, this is a condition of what? Allergic rhinitis, also known as hay fever. Of course, you need what? Antihistamine to help you to relieve what? The symptoms. All right. So now, like I said earlier on, all options here are antihistamine, but only loratadine and Tavigil have weak sedative or hypnotic what? Effect. These ones have what? Weak sedative or hypnotic what? Effect. What it means is that these two drugs have little or no effect on the CNS or the central nervous system. So these two drugs, they have very low effect or nothing at all on the central nervous system. So your answer, you should be directing your answer towards what? Loratadine and Tavigil. But of course, among the two, we normally prescribe what? Loratadine. Among the two, we normally prescribe Loratadine. So basically, that is just it for this particular question. So your answer here should be what? Should be B. It should be B. All right. So what do we have? I think there's a mistake here. All right. Okay. So we have what? During an operation. Okay. So during an operation, a patient got injection of what? Muscle relaxant, botulinum. Relaxation of the skeletal muscles and inhibition of the respiration lasted 2 hours. This condition was caused by the absence of which enzyme? The absence of which enzyme? So first of all, you need to know what a muscle relaxer is, a muscle relaxant is, and what it contains. All right. So let's move quickly to it. So muscle relaxants, what do they contain? They contain what we call succinyl what? Choline. Succinyl choline, which causes short-term paralysis as part of general anesthesia. All right. So when you're doing all this surgery, for example, during intubation and things like that, you have to give muscle what? Relaxant to help to cut the place and, to do your insection of the tube and stuff like that. So it's just for, usually it should be more than 10 minutes and it should be done. All right. But sometimes problem cannot occur. So that's what happens. So this succinyl choline, to neutralize it, you need an enzyme called plasma cholinesterase. Plasma cholinesterase. So this neutralizes this what? Enzyme. It neutralizes succinyl choline enzyme. And of course, another name for the plasma cholinesterase is called pseudocholinesterase or butyrocholinesterase. butyryl cholinesterase. So all of these things all mean plasma cholinesterase. So if you look at our options over here, of course, E should be our likely what diagnosis or our likely answer to this particular question. So therefore, deficiency of this leads to lack of restoration of the muscles and the what respiration, because this is not there. So this is supposed to neutralize this for everything to come back to normal. But here's the case, there is deficiency. So what happens? It will prolong. It will prolong. It will prolong. So the answer here should be what? Should be E. So what then is what? A peroxidase. So peroxidase activities main role is to protect the organism from oxidative what? Damage. Oxidative what? Damage. And usually, so E deficiency normally leads to what? Hemolysis. That is, if it has to do with what? The red blood cells. It can easily lead to what? Uh, Oxidative damage of the red blood cells, causing what? Hemolysis. What about catalysts? Catalysts also function the same way as peroxidase. So they help protect the body also from what? Oxidative cell damage by breaking down hydrogen peroxide to water and oxygen. To water and oxygen. So their deficiency will cause what? A lot of problem with red blood cells again. Then of course we have our acetylcholinesterase, which is an enzyme whose primary function is to catalyze and promote the breakdown of what? Neurotransmitter acetylcholine. So it destroys this acetylcholine. Acetylcholine are found in what? In neuronal what? Cells, all right, and even other places. So these enzymes breaks it down. So this, it has got nothing to do with muscle what? Relaxation. It has got nothing to do with it. So that is why over here our likely or our correct answer should be what? The E, or butyryl cholinesterase enzyme. All right. So let's move to the next question. What do we have? We have an examination of a patient suffering from cancer of the urinary what? Bladder. And they revealed what? High level of serotonin and hydroxyxanthranilic acid. Oh yes. So this is caused by excess of the following what? Amino acid. So what it means is that how can you connect this to any of these how do you call it? Amino what? Acid. So usually 3-hydroxyxanthranilic acid is actually an intermediate in the metabolism of tryptophan. It is an intermediate in the metabolism of tryptophan. And also serotonin is also called what? 5-hydroxytryptamine, which is also what? Synthesized from L-tryptophan. Don't forget, we also have what? The D-tryptophan. But for serotonin, it is synthesized from the L-tryptophan. The L-tryptophan. And what did they do? So the body uses this tryptophan to help make niacin. Of course, if you know your vitamins, you know how important niacin is, melatonin, and serotonin. And serotonin is thought to regulate mood, happiness, and anxiety. So if you are not happy, that means your serotonin level is actually what? Down. It's actually what? Down. So low levels of serotonin are linked to depression. That is why people who are having depressive disorders or who are depressed, we give them something that is related to what? To serotonin. So while increased levels also what? Leads to decreased what? Arousal. The answer is 8. Let me just show you how it really what looks like. So this is uh the pathway. Yes. So this is what? Tryptophan. As you can see, this is your tryptophan. And you can see it leads to the synthesis of what? Serotonin. All right. And again, it leads to what? To what? A protein formation. Don't forget, it is an amino acid, and many amino acid forms what? A protein. All right. So this is what? The pathway. And as you can see, this is what? The 3-hydroxyantranilic what? Acid present. So that should tell you that because of increased level of this tryptophan, all of these things are also what? So this goes high, and this also what? Goes high. So that is why, without any doubt, you know for sure your answer is A. All right. So we have the blood of a 12-year-old boy presented with low concentration of uric acid, very low, and there's accumulation of xanthine and hypoxanthine. This child has genetic defect of the following what enzyme. So now we're going to look at what how uric acid is what synthesized. So that is what our focus, because they are saying that there's low what concentration of what uric acid. So what it means is that uric acid is actually what a product. It's a product of the metabolic breakdown of purine what nucleotides. Purine what nucleotide, and it is a normal component of urine. So actually, when you urinate, you will see some level of what uric acid being what present. Now, the last two steps in the uric acid biosynthesis is catalyzed by what? By the xanthine what oxidase. It is catalyzed by xanthine oxidase. So deficiency of this enzyme will definitely lead to what? Reduction in the uric acid concentration. All right, because the last two steps, you need these ones. You need these oxidase. So if this is deficient, what it means is that the amount of uric acid in the urine will be reduced. So what then is urease? So a urease catalyzes what? The hydrolysis of urea into ammonia and carbon dioxide. So of course, we're not talking about ammonia, we're not talking about what carbon dioxide, we are talking about what? Uric acid. But let me show you a diagram of what this xanthine what oxidase. Let me show you a diagram. So over here, your answer should be C. But let me show you a diagram here. Now look at this. So like we said, the last two steps. So this is your uric acid, which is actually what excreted. All right. This is so 75%. You see them what in urine. So this is your uric what acid. This is what your xanthine, and this is what your hypoxanthine. So that means that from here coming down, you need what xanthine what oxidase. So if this is deficient, what it means is that this will not come off, and xanthine will not also what come off, and of course you won't get your uric acid in the urine. So it's going to be what reduced. It's going to be reduced. So that is why over here your answer should be what? Should be C. But what is this ornithine carbomotransferase? So let's look at it as well. So this is actually what? The urea cycle. But the question is not talking about what? Urea cycle. No. Neither is it talking about ammonia. No. It's talking about what? Urine. Now with urea cycle, that is where we have what? Your enzyme. So your enzyme here is here, number 2. And you see your number 2 is what? The ornithine what? Carbomotransferase. All right. So if we're talking about the citrulline and stuff like that, then we can be thinking about it. Then we can be thinking about a low what? Urea. But we are not talking about what? Urea. And even with urea, look at this. We have what? Adenine here, whose enzyme is what? Adenase, right? But we're talking about adenase over here. We are not talking about urea over here. We're not talking about what? Citrulline over here. We're not talking about urea over here. So obviously, this one is out of what? Of question. It's out of question. That is why you need to understand what each and every one there is what is doing, so that in an exam, it will help you to find the right what answer. Now the Krok people, they are smart. They try to confuse us, but here we are. We are trying to get everything done. So please take this serious and then study them. So what do we have? We have a patient who suffers from what? Insomnia caused by emotional disorder. You know, people who think too much, people who are emotionally depressed, they cannot even what? Sleep. So they have what? Insomnia. Was prescribed a hypnotic what? Drug with tranquilizing effect. So your key word here is what? Tranquilizing what? Effect. So what hypnotic was prescribed? Look, all of these ones are all what? Hypnotic what? Drugs. All of them are hypnotic what? Drugs. So, but then let's differentiate them right now. So actually what? Bromisoval, phenobarbital, chlorohydrates, and sodium etaminal are all hypnotic what? Drugs, but with narcotic type of what? Action. Yes, narcotic type of action. However, nitrazepam nitrazepam is also what? A hypnotic what? Drug from what? Benzodiazepine what? Class, and has this tranquilizing what? Effect, and has this tranquilizing what? Effect. So of course they're asking you for what? The one with tranquilizing what? Effect. So obviously your answer should be what? Should be E. As simple as that. And again, this phenobarbital and then the sodium etaminal are all derivative from barbiturate acid. They are derivative from barbiturate acid. So in case in a question they ask which ones or which of the following are derivative from barbiturate acid, of course you should know what to think about, or you should know what to worry your mind what about. So this one should be what? This. And again, bromisoval and chlorohydrate are all what? Aliphatic compounds. These are aliphatic what? Compound. But all of them belongs to what? Narcotic type, except nitrazepam, which is what? Benzodiazepine, and also what? Tranquilizing what? Effect. Okay, of course, they all treat what? Insomnia, and also induce what? Normal sleep. So the answer here is E. Is E as discussed. All right. All right, so let's move to the next question. So we actually have what? A patient is ill with what? Diabetes mellitus accompanied with hyperglycemia on an empty stomach. The glycemia rate can be retrospectively estimated, that is over the last 4 to 4 weeks before the examination, on the ground of the following blood plasma what? Protein. Blood plasma what? Protein. So this one, we want to know which kind of test we can what? Use to estimate this kind of what? Glycemia. So of course you already know what diabetes is. So it is just what? The inability to produce or respond to insulin. Therefore, it leads to what? Elevated blood glucose level. Elevated blood glucose level. So what happens? So these are the tests that I normally do to diagnose it. We have three main. We have what? The fasting plasma glucose test. We have the oral glucose tolerance test, and then we have the HbA1c, that is glycated what? Hemoglobin. Glycated hemoglobin. Now, a fasting plasma glucose test is conducted when the person has not had any caloric what? Intake for at least 8 hours. So usually we normally advise them to come early in the morning to do this test, because we believe that when you sleep, of course, you don't eat. And from that time till morning, it should have been 8 hours. So just come, do the test, then we know what is happening with you. Basically, that's what we normally do for fasting plasma glucose. All right. Oh, no. The answer should be A. The answer should be A. But then the answer is A, not B. Is A. All right. So what about the oral glucose test? So this one is kind of complicated, and we don't frequently what? Use it as we use the fasting plasma glucose what? Test. Now, what about the glycated hemoglobin? So for this one, it has a long-term use to evaluate long-term glucose what? Control in people with known diabetes. So like we said, retrospectively. That means, over the last 4 to 8 weeks. So this is the test that we are going to do to, ascertain the level of GM. All right. So of course, if the level is 6.5 or higher, then it indicates that this person has what? Diabetes. This person has diabetes. So basically, this is just it. And so the answer here should be what? Should be glycated hemoglobin. Glycated hemoglobin. So basically, this is what we'll be doing in subsequent what? Videos, and I will entreat us all to be part of our online tutorials. So I'll put a link in the description box. Go through it, sign up, and let's do something together. And of course, I'll be starting on the 1st of July. 1st of July. So please, you don't want to miss any of my videos. So join us and let's roll it. All right. So see you. Bye.